Howdy, everybody. We have a great show tonight on this pre-Christmas Poop Tip Tuesday. We will discuss how to avoid jet belly if you're going on vacation, maybe on an airplane, you're worried about your belly getting bloated or what's called jet belly. We'll discuss that. We'll discuss the differences between what is car sickness and what you can do to hopefully get that taken care of you. And lastly, we'll talk about food poisoning versus the stomach flu. What is what? How to treat both. Any questions you guys may have live on today's Poop Tip Tuesday. Guys, let us go ahead and talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns. And I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. All right, so if you're joining me for the first time, my name is Dr. Islam. Let me take the counter off. And yes, I am an actual poop doctor. My passion is to give you, yes, you, my live audience, tips and tricks so you can live your best life. If you haven't already, let me know if you're watching this live or on the replay. And also let me know where you are watching this at as well. Raymond Carter, thank you for watching from Idaho. And if you haven't already, don't forget to smash that like button, like, share, and subscribe so you can send this to all your friends and you can let me know what you guys think as well. Hope you guys are having a happy winter, happy December. It doesn't feel like December over here in Texas. The weather is great. Hope you guys have great plans, staying safe during the Christmas holiday. I know I have plans to not do a lot, to spend time with both my family and my friends and with my loved ones as well. And if you have a question you guys want me to answer as well, let me know on the comments and we can hopefully get to those as we do our live show today. Shelly, it's good seeing you. Thank you for watching from Canada. Hope the weather's not too bad over there. Jennifer, it's good seeing you as well. And Andy, it's good seeing you as well. Thank you for watching on the live stream. All right. So 3 main topics we'll talk about today. The first one is how to avoid jet belly. Have you heard about this term? Do you know exactly what I'm talking about? Because this is an actual term that a patient asked me about. Say, hey, Dr. Islam, I am planning on going on a trip on the plane and I want to make sure I don't get that jet belly. And I was like, what the heck are you talking about? I have no idea what that is. I looked this up. This is an actual term when you travel or go on a plane in which your belly gets so big and distended, you feel like you're 9 months pregnant. Let me know in the comments down below if that is like you or if you felt this as well. And it's actually a true term. It's actually used in the airline industry. What actually happens is that as you go up on a plane or go into different altitudes, that changing in the altitude will actually cause gas in your belly to get bigger and will cause your belly to expand as well. So you have that sensation of just a full belly, feeling like you're 9 months pregnant, and you're feeling you can't pop enough gas. You can just poke a little pin needle on there, and all that gas will come out. And bloating in of itself is a terrible condition to have. It's such a problem for a lot of my patients. And bloating on an airplane, I'm sure it's even worse to have those issues with that as well. So if you suffer from bloating, or even if you're worried about what may be causing bloating whenever you're going on vacation, don't you worry. Your poop guru is here to give you tips to help out with that. So number one, my recommendation for bloating in general and also for jet belly is to determine the trigger foods that most commonly cause bloating. I'll give you the ones that I typically recommend for people to avoid. Milk products is one of the biggest ones that I recommend for people to avoid. A lot of people don't realize that they are lactose intolerant, and this can occur either as a consequence of age or especially later on in life. And so milk products like cheese, milk, ice cream, you cannot metabolize that correctly, and all of a sudden you have this gas and buildup inside your belly. Number two, broccoli. Broccoli is so great. I love broccoli, but it produces a lot of gas. It's one of those foods we typically try to minimize whenever somebody has a lot of gas inside their belly. Number three are Brussels sprouts. I, for the life of me, cannot eat Brussels sprouts. It is a terrible problem that I have. My gas is really, really bad when I have Brussels sprouts. I can't believe I'm admitting that on a live stream, but yes, it's true. I also have gas issues when it comes to Brussels sprouts as well. Beans and cabbage are the big ones as well. So kind of you want to avoid those trigger foods that most commonly can cause bloating to occur. Number 2, if you're going to go on a flight, I would recommend for you to minimize or even skip alcohol and caffeine. That can both cause irritation of your GI tract, to make your GI tract more sensitive, and also to make you feel more bloated than what you may be as well. Number 3, you probably know this, you want to avoid carbonated drinks. That carbonation, that fizz that's in those carbonated drinks fizz is actually gas you are ingesting, and that's going to make your bloating and gas a lot more difficult around your belly as well. Number 4, I would recommend to try some herbal teas. Herbal teas are fantastic. They help out and they help minimize bloating, even if you're having bloating when you're not traveling. Things like chamomile tea, ginger tea, lemon tea, and peppermint tea help to soothe the gut, keep your bloating down, help out with distension, and also allow you to not have as much gas. Number 5, I recommend to keep on moving. Don't just sit on that long plane. Whenever you get a chance, walk down those aisles. Get your body going. Get your body moving. Your body and your bowels like movement. And that's going to help out with the jet belly and bloating as well. Number 6, if you're chewing gum, guess what else you're doing? You're swallowing a ton of air. It's called aerophagia. And so if you're chewing gum, don't do that anymore. Minimize that. Minimize the amount of air that's coming into your mouth, into your belly, because once it goes into your belly, it pretty much causes your belly to get bigger and bigger and bigger. And while you're at it, if you're chewing gum, make sure it does not have artificial sweeteners in them. In fact, eliminate all artificial sweeteners. There are people who just cannot digest those artificial sweeteners, and whenever they do digest that, it causes an explosion inside their GI tract to cause bloating and distension to occur. And then lastly, try taking some anti-gas medication like Gas-X. This works really well, helps to decrease the bloat, decrease the jet belly, and allow you to travel safely. But these are my tips I recommend for not only jet belly, but for anybody who has bloating issues. These are things that I recommend in my clinic. All right. Prasad, thank you for watching on the live stream as well. I appreciate it. All right, perfect. All right, guys. All right. If you haven't already, if you're joining me for the first time, my name is Dr. Islam, and yes, I am your poop guru. Let me know if you're watching this live or on the replay, and also where you're watching this from as well. All right. All right, question number 2. Dr. Islam, what is car sickness and how can you avoid it? So car sickness it sucks. It is terrible, especially if you're going on that long drive. I know some of you guys may be traveling during the Christmas holidays. I know some of you guys may be going on long distances, maybe not taking that airplane, but maybe actually traveling in a car. So you may be wondering, you may be one that actually suffers from motion sickness, or you may be one that has family members that are suffering as well. So why do people actually get motion sickness? What actually happens is that you actually have conflicting information between different sensory inputs, what your eyes see and what your body is doing. So for example, for a lot of people who have motion sickness, they just see things moving and moving and moving through their eyes, but their body's not doing anything. And it's that disconnect between what you actually see and what your body realizes is going on, or in actuality what is going on, that causes people to get motion sickness. It is such a terrible thing to have. One of my kids very commonly gets motion sickness whenever we go on long rides. So I feel like I'm an expert on this because I have to help treat my kids when it comes to that as well. So if you're one of those that actually gets motion sickness, or you're worried that this may be you, here are my tips to help out with that. Number 1, there are a lot of over-the-counter options to help out with motion sickness, like antihistamines, patches, things like that. They work well, and we typically recommend for you to take this before you go on your trip so that you don't have those issues when you're actually traveling. If you take it prophylactically before you go on your trip, that's going to hopefully minimize that motion sickness you may get whenever you are traveling. Number 2, take herbal treatments. They actually do work to help out with the nausea and the motion sickness issues that can occur. Things like ginger tea, peppermint tea, chamomile tea. These things work. They actually have good evidence behind them to help out with gut issues, nausea, and motion sickness as well. Number 3, consider getting some fresh air. Roll down that window, get that air in you. That actually will help out when it comes to not feeling that motion sickness and getting you feeling better as well. Number 4, it's kind of a trick that I learned. You want to gaze off on that distant horizon. Look far away, not at the things that are rapidly moving through, but maybe at that mountain, that hill off in the horizon. If you gaze off that way, that's going to help minimize the motion sickness that you're having as well. Number 5, make sure you are traveling in the right location. So for example, if you get motion sickness, sit in the front of the car, in the passenger seat, or if you can't, sit next to a window. Don't sit next to a car or next to a tire that's driving. Try and sit in the front, next to the window as much as you can so you can see exactly what's going on. Typically in the back, in the middle seats, tends to be the worst places to get whenever you get motion sickness. And then lastly, I would not recommend for you to use your smartphone or to read whenever you're traveling if you're having motion sickness. That movement of your eyes, that scrolling of your phone that's occurring is going to contribute to the motion sickness problem. Let me know in the comments down below if you've had problems with this. Would you add anything else? Would you change anything when it comes to treatment, or what things you guys have done when it comes to motion sickness as well? Mary Han, thank you for watching. Adrina, thank you for watching. Sarah, thank you for watching as well. Taz, thank you for coming back on the live stream as well. So Shelly, great question. You have a question that says, my dad has colon cancer. What chances do I have of getting it? Thanks. It's a very good question. And so what we do know about colon cancer is that your risk for colon cancer does increase when it comes to your first degree relatives that actually have colon cancer. So if your dad has colon cancer, there is a significant chance that you may be at risk. And typically what we recommend is that you want to start your screening test, meaning your colonoscopy, at least 10 years before the age of when your dad was diagnosed. For example, if your dad was diagnosed at 50, you need to get it at least at the latest at the age of 40 years old. And so having that first degree relative of colon cancer substantially increases your risk. But if you get your colonoscopy done earlier, you almost dramatically will minimize or decrease the risk of you developing colon cancer. Hey, Audrina asks, can endometriosis in the colon turn to cancer? Typically not. So you can get endometriosis in the colon. These are implants from endometriosis in general. Typically, some patients will have pain that occurs during the time of their cycle, but there's no evidence that having endometriosis in the colon will progress on to colon cancer. Great question. Ellen, thank you for watching from Canada as well. Cruz, thank you for watching as usual as well. Thank you for watching everything. So Jennifer, great question. Why does traveling seem to exacerbate IBS? Oh, it's just such a great question. I have a couple of videos on what you can do to help out with this. I would encourage you to look on my YouTube page and Facebook page for that. But traveling makes IBS worse for a lot of different reasons. Number one, you are in a different environment than what you normally are in. So for example, you're traveling, you're in a different city with different foods, different hygiene, different ways of eating. Typically when you're traveling as well, you're going long distances without your normal routine. So you're not using the restroom as regularly as you would like, or if you're on an airplane, that change in altitude will change how much water gets absorbed in your colon. Number three, you may not be moving as much, and that may make IBS issues a lot worse. Number four is that the foods that you're eating when you're traveling typically are not the best foods. I know that when I travel, I commonly don't eat very, very good, and that will make my gut issues like heartburn a lot worse as well. And then lastly, number five, sometimes traveling can be stressful. Even though you're going for vacation, it may be stressful, and that stress can make IBS issues a lot worse. So what do I recommend? So when you're traveling, I would be proactive in terms of what you do. So number one, if you can plan where you're going to eat, try and do that. Number two, make sure you drink a lot of water. Number three, make sure you can plan your restroom stops when you're traveling. If you're traveling by car, use the restroom, plan those stops, walk around, do what you can. Or if you're traveling by plane, know where the bathrooms are and be proactive when you do that. Number four, if you need to take medications prior, like an anti-diarrhea medication or a medication to help you use the restroom, do that to get on top of your IBS. And then lastly, number five, you may want to consider eating a lot of prebiotic foods which will help out when it comes to IBS issues just in general. Great question. It's a very common problem to have. Let me know in the comments down below if you have any other tips you'd recommend whenever you're traveling with IBS. All right. Perfect. So question number 3, food poisoning versus the stomach flu. What is it and how do you treat both? Let me know in the comments down below if you are someone that has had issues with either one of these two things. Are you confused about what it is? So the symptoms are very, very similar. In fact, a lot of people who have the stomach flu may think they have food poisoning, or vice versa. Those people who have food poisoning may think they have the stomach flu. But there comes some subtle differences between the two. So food poisoning actually comes from something that's bad in the food. The most common things being bacteria, whether it's food that's not cooked, food that's cooked in places that are not very good, whether it's food that is maybe not handled very well or not very clean. It's usually something wrong inside that food. Whereas a stomach flu is usually due to a virus, due to something outside that you actually inhale or you ingest from the outside, which are typically viruses. The symptoms are very, very similar, though I would say that food poisoning in general tends to be a little bit more in terms of serious symptoms, with longer episodes of nausea, vomiting, diarrhea, and pain than somebody who has the stomach flu, because typically viruses in and of themselves can be released very quickly. This will also be the reason why people don't suffer as much when it comes to the stomach flu. Now, because the stomach flu is due to a virus, the way you treat that is the way you treat any other virus. Fluids, hydration, anti-nausea, anti-diarrhea medications, Tylenol, things like that. We don't give medications for somebody who has a stomach flu because typically it's a virus. Now, food poisoning, it depends on what we think is the cause for the poisoning. Most of the people who get food poisoning is very self-limited, meaning it'll last for a day or two. They'll get better on their own as long as you do the hydration, have the brat diet, get some rest. But sometimes if the infection is severe, you have severe fevers, pain, bloody diarrhea. We actually may do some stool testing, see what's going on, and maybe necessary, we'll go ahead and give you some antibiotics. And because we know that the most common cause to get food poisoning is due to bad bacteria inside the food. And if it's so infectious that it's causing you to have severe systemic or bodily type symptoms, we want to give you some sort of medication to help out with that. But in both cases, fluids, hydration, having the brat diet, a very bland type diet, will help out tremendously when it comes to having treatment of both issues. All right. All right, perfect. Prashant asked a very good question. Why do I have globus sensation in my throat whenever I eat? So globus sensation is that sensation of that frog feeling in your esophagus when you have to constantly swallow and you feel like that there's that lump in that throat. Now, globus, Globus is the term. It's a very common problem to have, but it's also multifactorial, meaning there are so many different reasons why people have that sensation. Sometimes it is something inside the esophagus, whether it's a big goiter or a thyroid issue. For some people, it may be an acid issue as well. For others, it may be postnasal drip from allergies. Maybe it's even seasonal allergies as well. Or sometimes people feel that sensation that's there and they have just a reflex of having of that sensation that's there, even though nothing is there. And this is one of those conditions that are very difficult to treat because it's so multifactorial. It may not be just one condition that's there. If we're focusing on the GI tract, sometimes we will treat reflux aggressively to see if this will help out. Sometimes we'll take a look with the scope as well. Sometimes we'll send you to an ENT doctor to see if they understand what's going on because of that risk of that postnasal drip. But once again, it is a very difficult symptom for us to really know the true cause of. All right, guys. I want to thank you guys for watching today. Hope you guys have a happy and safe Christmas holidays. I hope you guys have a happy new year. I may not see you before then. If you guys do, be safe, be happy. I look forward to seeing you guys in 2022. Stay good, and I hope you guys do well. Don't forget, let's talk about poop. Thanks, guys. Have a great day.